Hi, my name is Dr. Nicholas Ahi. I am a neurosurgeon with HCA Florida neurosurgical specialist here in Margate. So I work with a group of 5 neurosurgeons, and I focus on cranial procedures for the group. So that means treating tumors of the brain and the spinal cord, as well as cerebrovascular conditions. For my patients, I take a lot of time when we sit down in the office. I want to get to know them, their families. I want to make sure that they truly understand the condition for which they're seeing me, and then we come up with a treatment strategy together. It doesn't always involve surgery at the initial visit. Sometimes we have other strategies to get the patient through their condition, but at the times that we need to have surgery, we sit down and discuss the options, the details of the procedure, what the expected recovery is like, and I make sure that they have continuous access through me throughout the entire process so that I can make sure that they never feel alone, that they never feel that they don't know what the next step is, that they always know what's coming next. The best days that I have are the days when patients who came into the hospital extremely sick, they were paralyzed on one side, they couldn't speak, they weren't waking up, and after surgery that I see improvements. And sometimes improvements don't always happen right away. Sometimes when I see patients in the hospital, they're unable to walk, they're paralyzed because they're so weak from a tumor or another reason. And then when they come into my office and I see them and they're without a walker, they're able to get up on the exam table themselves and they want to show me, that's a really prideful moment for me, and one where it really ties together all the training that I've had, all the years that I've put into in order to learn to take care of patients with these conditions.